All right, today we're jumping into some really fascinating research. We're talking about diet and supplements that are being looked at to potentially work alongside standard treatments for endometrial cancer.
When you're going through standard treatments, it's so natural to ask, okay, but what else can I do? And that's not just the question patients are asking. It's the exact question that's pushing researchers to find other evidence-backed ways to support people on this journey.
Okay, before we get into the nitty-gritty, I have to put a big, bold disclaimer right here. What we're talking about today is a summary of research. It is not medical advice. The whole point of this is to give you some really solid information so you can have a better, more detailed conversation with your own doctor. Always, always talk to your oncologist first.
All right, let's get into it. First up, we're looking at something pretty unexpected. A connection between cholesterol and endometrial cancer, specifically those cholesterol-lowering drugs we all know as statins.
Get this, a massive study looking at Danish patient data found a 57% lower risk of mortality for patients who started taking statins after they were diagnosed. 57%. That is a number that really makes you stop and take notice.
So what's the story behind that number? Well, it looks like the longer people use them, the better the outcome. And the benefit was biggest for people who were responders, meaning their LDL, that bad cholesterol, actually went down. This is super interesting because some cancer treatments can actually make your cholesterol go up. Plus, there's some newer research that suggests cancer cells might actually use cholesterol as a kind of fuel.
Okay, so from a prescription med, let's switch gears to something you can grab right off the shelf at any pharmacy. We're talking about low-dose aspirin, that classic inflammation fighter.
And here's another jaw-dropper. One analysis found a 77% reduction in disease-specific mortality for women taking low-dose aspirin. And what makes this number really stand out is that the researchers adjusted for other risk factors, which makes this finding feel pretty solid.
So you're probably wondering who benefited the most here. The data seem to point towards women with a higher BMI and also younger patients who are in the early stages of the disease. But the researchers really zeroed in on one group, those who had radiotherapy after their surgery. For them, the link suggested that aspirin might help keep the cancer from coming back for longer.
All right, for our third stop, we're moving away from meds entirely and looking at a basic but crucial mineral, zinc. It turns out there's some powerful research connecting zinc levels to the chances of the disease coming back.
Here's the key takeaway. One study found that patients whose cancer came back were almost 5 times more likely to be deficient in zinc. And what's really interesting is that this deficiency didn't seem to be linked to what they were eating or the kind of treatment they had. It was an independent factor. And when you look at how this might affect survival rates, wow, the difference is just dramatic. For patients who had enough zinc, the 5-year survival rate was 35%. But for those with lower levels, it plummeted to just 10%. That is a huge, huge difference.
The researchers themselves were really direct about this. They didn't beat around the bush. Their conclusion was basically a strong recommendation. They said that gynecologic oncologists should be actively checking zinc levels to help improve the outlook and quality of life for their patients.
So, we've talked about statins, aspirin, and zinc, but that's really just the tip of the iceberg. These are just a few examples from a huge, growing field of research that's looking into all sorts of different compounds that might help support patients.
And this just gives you a little taste of that bigger picture. You've got scientists looking at selenium and whether it can help keep the disease from progressing, or melatonin and its potential role in quality of life. Even things like lactoferrin for helping to balance out the body's iron, which can sometimes get thrown off by endometrial cancer. Every single one of these is a whole area of study on its own.
Okay, so we've thrown a lot of information at you. What's the takeaway? The most important thing is not to see this as a checklist of things you have to do. Think of it more as a toolkit, a way to feel more empowered in your own journey. And that really brings us full circle, back to the most important point of all. The whole goal here is to arm you with good, solid research so you can go to your oncology team and have a really specific, informed conversation. So you can ask questions like, hey, I read about a study on zinc levels. Is that something we should be looking at for me? And that leaves us with one final, big question to think about. As all of this research keeps piling up, what could the future of cancer care really look like? Imagine a future where the absolute best of standard treatment is woven together with these kinds of evidence-backed complementary approaches, all of it personalized just for you. It's a pretty powerful idea, isn't it?